Good morning, good afternoon, good evening, everybody. My name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome. Before we begin today, a word of thanks to everybody who helped make today happen. In particular, thank you to our co-host, the AHF Global Public Health Institute at the University of Miami. And thank you to our team here at Boston University, particularly Meredith Brown and Alicia Noel. Core to public health is the view that health is a public good, sustained by collective investment. This is true at the local, national, and global levels. A healthy world is one where we work as an international community towards an ideal of better health for all. Supporting this is the idea that our health is interconnected. The emergence of disease anywhere on Earth could quickly become a problem for everyone, not just the region where it first appeared. It behooves us then to work together to make sure everyone has equal access to health, regardless of where they live. But the last year and a half have made this ever clearer. The COVID pandemic has been a global challenge. It has touched and continues to touch every part of our world, linking us in our shared response to crisis. It has amplified the need to respond to such challenges as a global community, to coordinate our efforts towards a healthier world. In response to this need, the Lancet Public Health recently published a piece calling for a global health convention for the 21st century. We are pleased today to have with us the intellectual architects of this piece, along with distinguished guests who will help contextualize how this convention could lay the groundwork for a healthier world. I look forward to learning from them about how we can create a healthier global community in the post-COVID era. It's now my great pleasure to turn the screen over to today's moderator, Dr. Jorge Saavedra, Executive Director of the AHF Global Public Health Institute at the University of Miami. Jorge, thank you for your partnership. Over to you.
Yeah, well, thank you very much, Sandro, for this starting and introduction and for the idea of having these discussion forums and this time to address the Global Public Health Conventions and the proposals that have been published already, one at the Lancet on May 5th. And then you actually invited some of the speakers. And yes, at the AIDS Healthcare Foundation, AHF, the AHF Global Public Health Institute, and the University of Miami are really happy and honored to be part of this effort. So this time, we are going to hear from four distinguished panelists and about the Global Public Health Conventions, the proposals, the pros and cons, I assume, and also what it means and what it takes to get there. But first, we will hear from Dame Barbara Stocking. Dame Stocking became the fifth president of Murray Edwards College at the University of Cambridge in the UK in July 2013. Dame Stocking is also the chair of the panel for a Global Public Health Convention established just recently, last April 2021. So overall, she will give a kind of a framework on why a new Global Public Health Convention is needed and what it takes to get there. But then during the discussion, some of the panelists and Dame Stocking herself, we will be able to get into more specifics. Dame Stocking, the floor is yours.
Thank you very much indeed, and thank you also for that warm welcome that I was given at the beginning, and Sandro's words. I want to start, as Jorge has said, directly with why it is that we need a treaty that probably means some sort of framework convention. But the purpose of it is to stop infectious disease outbreaks becoming pandemics. That is the core of it. Now, it's unlikely that we can stop all outbreaks, not least because we know there are hundreds of thousands of viruses in animals and birds which may translate and be transmitted to humans and then actually change from human to human. So knowing that there is a risk, then there is a real need for a much more rigorous and coherent response, particularly to outbreaks, but all the way through as pandemics go on to develop. Now, experts have been warning us for at least the last 20 years that we could expect a pandemic from a respiratory virus like COVID-19. And of course, that is what has happened. And they have said that the world wasn't prepared. Now, the awareness of that was taken forward in 2005. The international health regulations went into a form of treaty. But important though the IHR, as I'll call them, are, they're not complied with in the middle of these outbreaks and pandemics. They're not also, they need updating. There are some areas that really they're not covered in those IHR as well. Now, we've had the devastating COVID-19 pandemic. And the question is, have we really learned from that? Have we learned that we have to do and behave differently in the way Sandro has talked about being together all across the world? Or are we going to leave ourselves open once again to more pandemics like this in the future? So our panel is really working to make sure that that does not happen. We can talk later on about the political dynamics of what's happening and how people are trying to take the ideas of a treaty forward. But the absolute key to us is that it really has to happen now. It's so obvious what we need at this moment as we're still in the middle of this pandemic. So that's what our panel is really advocating for. So I will just give you a bit of an introduction about what we think a treaty might have to deliver for us, and therefore how what is needed in it. And if I could just ask if the team would put up my first slide, please. Thank you very much indeed. Great. So what does a global convention do? Well, the first part of it is about preparedness. This isn't just preparedness about equipment, but it is about whole health systems. Ideally, of course, very strong healthcare delivery systems, but most important alongside that is really good health surveillance systems in place. And that means also understanding what you do with those surveillance systems. And in this pandemic, certainly as countries got underway, they really had forgotten the basics of public health, which is what you do, you test. And of course, that may mean developing tests, and you trace, and then you isolate people. Not easy, and very complex matters need to be taken in hand, but that's what you have to do to stop going from an outbreak to a pandemic. Now, we do also need, as people have recognised, we need immediate transparency of governments when they do have outbreaks. And of course, that also needs external validation of what's happened. Throughout, we need ongoing data sharing, and I'm thinking about things there about the genetic analysis of the various variants and so on. But also just knowledge about how the disease is spreading and numbers and what the issues are that they're causing. And of course, that too requires independent validation. Now, the bit that often isn't taken up particularly, there is some understanding in IHR about some of those parts, but what is not there really is this question about what responses are required. What do you do about these things? And there we have to see WHO as the standard setting body. As it puts out recommendations at the early warning stages and throughout, the question is, are governments going to abide by those recommendations, whether they're for their individual country and its particular issues, or whether it's more broadly? And at that, I'd like to mention something very important in that point. There is a thing called the precautionary principle that a lot of people will understand very well, that particularly with pandemics or epidemics, you cannot wait. It's the escalation that is the big problem. In many other walks of life, when you see an incident and so on, you can make a pretty good assessment about what's happened, what might happen, and so on. But with infectious diseases, you are really at risk if you wait. And actually, the panel that IPPR that Precious Matsozo was on made that very clear in their report. The whole of February 2020 was really lost, and everybody was waiting to see. And you really cannot do that then. So there's action needed and specifics of that. But what we then need, which has been missing from the IHR, is that we need a way to do monitoring and inspection to check that there is compliance from countries. And that, of course, is a part of what comes from a treaty, to have compliance measures within it. So if I could have the second slide, my second and final slide, just to say more then, if this is what we're trying to get a treaty to do, now how's it going to work? What's needed for the treaty framework convention itself? Well, the first part of it is it absolutely has to be agreed at heads of state level. As we know, COVID-19 has affected all walks of life, and therefore decisions are taken at the highest level. So they must be, heads of state must absolutely be central in the negotiation and the responsibility to carry forward and implement what is in the treaty. I've suggested that before, but in this talk, that of course it should build on IHR, but that will need some extensions. It will need a monitoring and inspecting body for compliance. There are some big questions about where that should be, who it report to and so on. But the real central point of this is we actually need incentives for countries to engage and disincentives if they don't. To some extent, that is an easier thing to do with low and some middle income countries, because those countries, as it said in the next point, will need financing for preparedness and response. We know that much more money needs to go into that preparedness, but also particularly in those countries, finance has to be made available to them very quickly when an outbreak starts so that they can get on top of it straight away. So the questions are, what are the other incentives that bring people in? And that is the issue about working together across the globe, recognizing that no country is on its own and no country will be free if all are not free. Now, the way a framework convention works is that it will have a treaty body, it will have conferences of parties so that each you can meet and actually add protocols to a convention. And it's that ability to add more in that we think is quite important. The first thing is we have to have protocols that cover preparedness and response. That is absolutely vital in case the next infectious disease comes along very quickly now. But also, you'll all be aware of the issues about equity of access to global goods, the vaccines, the drugs, and so on. And that could be built in very, very well into a protocol. And of course, another way of looking at this is also really looking at prevention, particularly through One Health measures, because I've said of the zoonotic transmission of these viruses that are so severe. That's quite complex and needs a lot of different bodies to be involved in, but they could all, over time, be covered in protocols. So we think that's, this doesn't, as I say, go into all the politics of this or all the details of exactly where different bodies or financing should come from and so on. But the fundamental is we have to get real, the global world and the global leaders galvanized to actually move on this, because it is so badly needed now, and it most certainly will be needed in the future. So thank you very much for letting us come and talk today to spread the ideas about a global treaty. And over to you again. Thank you.
Well, thank you very much, Barbara, for this great opening and giving us a wide panorama on the Global Public Health Convention and why it's needed and how can it become a reality. But then we will hear from some other panelists here, and we will now turn to Dr. Ricardo Baptista Leite, a medical doctor and a member of the Portuguese Parliament, where you sit at the Health and Foreign Affairs Committee. In Dr. Baptista Leite's role as Member of Parliament and under the auspices of UNAIDS, he is the founding president of UNITE, a parliamentarians network to end HIV, AIDS, viral hepatitis, and tuberculosis. And it's a global platform for policymakers in order to address other infectious diseases. So, Ricardo, we would like to hear from you on what should be or what can be the role of members of parliament or congressmen worldwide in terms of this proposal for a global public health convention, and how can parliamentarians help to prepare their countries to deal with a new global public health convention? Well, that's a general question, but of course you are free to address some other issues that you consider important. Ricardo, the floor is yours.
Thank you, Jorge, and it's great to see you, and also thank you, Sandra, for the opening. And it's great to be among so many friends that I've met online over the last year. We still haven't met in person. In particular, we've been together in many meetings led by Barbara throughout the last few months. it is a true honor to be part of this meeting of this Global Public Health Conventions in the post-COVID-19 world, co-hosted by Boston University School of Public Health and also the Global Health Institute of the University of Miami. I would like to say that as we gather here today, we have the opportunity to discuss the pressing challenges we are currently facing and mostly how we should address them as a global community. As Jorge was saying, I'm a medical doctor trained in infectious disease. I'm a member of parliament, but most importantly, I'm here as the founding president of UNITE, the global network of parliamentarians committed to ending infectious diseases as a global health threat. And we were founded back in 2017. Now more than ever, our work is needed as a collaborating partner with all of the different stakeholders to make sure that what needs to be done, as Barbara was saying, is done to avoid, in this case, future pandemics. And we know that sadly, we are just one variant away from going back to square one. We're one variant away of going back to ground zero, starting a pandemic altogether. And so we cannot repeat the mistakes we've made in the past. And this pandemic has shown us that multilateralism and solidarity are key to address any global health threat. And we all know by now that, as Dr. Tedros has said so many times, no one is safe until everyone is safe. We know it, but we're really not practicing it. And one can see the policies around vaccination to see that when we think in terms of the global health scale and not from a nationalistic lens. However, we have, as I mentioned, throughout the past months, we have seen that not all international mechanisms are equally efficient. Furthermore, there aren't enough international platforms or spaces to address health as a global community from a global perspective. In this increasingly connected world, we cannot progress collectively without developing measures to curb the possibility of a pandemic threat. With that in mind, leaders from all over the world have joined the President of the European Council, Charles Michel, and the Director General of WHO, Dr. Tedros Ghebreyesus, in an open call for an international treaty on pandemics, drawing the lessons from the lessons learned during the COVID-19 crisis. Now, more than ever, is the moment to garner the momentum and to move forward with reforms of the global system to fit our pressing need for global health security. Today, we will be discussing exactly this question: what parliamentarians can do to prepare their countries under a new global public health convention. I was a member of a group of 29 experts that developed a set of recommendations to be better prepared to prevent next pandemics. This team also included several of our speakers today, including Barbara Stocking, Jose Zuniga, Michael Weinstein, Gisela Scaglia. And recently, as was mentioned, those recommendations were published in the Lancet Public Health. And when we look at them and looking at some of the key takeaways and looking at them from a political or parliamentarian perspective, one must ask, what must be included in such a new pandemic prevention treaty? Well, first of all, because pandemics affect every aspect of our life and society, the new pandemic treaty must be signed by leaders of government, representing all segments of state government, including but not limited to economy, finance, labor, health, education, security, and foreign affairs. And parliamentarians, representatives, elected representatives of parliaments, congresses, senates, have such an important role in influencing that governments take the stand. In certain countries, when the legal framework permits, actually defining the stand that the government can take and will take in such a new convention, one in which compliance is a reality, as Barbara was saying. Secondly, one of the reasons for the failure to detect early and contain COVID-19 was the absence of binding compliance regulations, as I was mentioning. So we must require a system of independent monitoring and establish mechanisms for enforcement. Once again, in most democracies, parliaments, congresses, and senates are the ones that actually place in those rules. We are the ones that have to make those decisions, some of which are not easy, some of which can be controversial, the need for parliamentarians to believe in what they're doing, to galvanize the support, to bring together different parts of society so that we as one can focus on making sure that these mechanisms exist is critical. Because if we do not do this, we will be just ending up with another treaty that has no practicality in the real world. And we will be facing all of the challenges that we faced during this pandemic. Once again, we must learn from the lessons and from the mistakes of this last year and a half. Thirdly, low and middle income countries need more financial and logistic support to prevent and prepare for pandemics. And lastly, a new pandemic prevention treaty must require transparency and incentivize countries to immediately declare infectious disease outbreaks in their territory. These transparency mechanisms, these observatories, if you will, that are permanently working on the ground need to be funded, need to be developed, and need to be multidisciplinary. And most importantly, they need to be set in stone in the law to exist, to make sure that they are acknowledged by the government, by all of the health authorities in each country, to make sure that they have the power to do what is needed to make sure that the world does not fall into the trap once again of another pandemic, and to make sure in a way that we take away some of the national politics that can in a way undermine our efforts of early detection and prevention and our capacity to contain future pandemic threats. As we know, there is a tendency sometimes for national governments not to react immediately, and that's why we need to give more power to those that are on the ground and have the scientific capacity to do what is needed. We know from prior infectious disease outbreaks, such as Ebola, that there is a narrow window of opportunity to influence the process. We know that that moment is now. In a few months or over the next year, as we see vaccination expand, especially among the richest countries in the world, we will see that the interest of dealing with this, especially because of the economic and social crisis that is looming, the social pandemic that is already in the making, will in a way push people away from thinking about COVID-19, thinking about pandemics at large. And that is a huge risk for us on the policy side. Because if there is no momentum in society, if people do not want to discuss in the next few months, what are we going to do to avoid a new pandemic? Well, then we're going to lose the opportunity to make the changes that are needed. And we will be repeating ourselves once again, as we've done in this last pandemic, where we saw that we repeated so many mistakes, even when we look back 100 years to the Spanish flu pandemic. So the moment is now. We need to mobilize parliamentarians, governments, and their constituencies who have such a pressing importance in this, in their role of making sure that their representatives do what is needed to ensure that the world gets a pandemic prevention treaty, gets this global public health convention it deserves. A convention that will protect us all from the current pandemic and especially from others to come. Thank you very much.
Well, thank you very much, Ricardo, for this presentation addressing some of the critical points, and also that they were also published, as you mentioned it, at the Lancet Public Health last May 5th, and all the implications that this might have. Thank you for this presentation. So now we are turning over to Dr. Jamila Mahmoud. I hope I'm pronouncing correctly. Jamila is the special advisor to the Prime Minister of Malaysia on public health. She is also a member of the Government of Malaysia Economic Action Council and is actively engaged in the COVID-19 response and recovery initiatives both on health, economic, and social fronts. She is also a member of the Global Public Health Convention panel. And well, we do have some questions for her, like in her topic, but I'm sure she will address that in some other issues, because the current pandemic started in Asia, but now, or it has been like Asia has been the less affected region in the world. So I don't know if Asian countries will have political willingness to sign a new global public health deal, but probably she can address this, but she can address many other things. I'll leave it to you, Jamila.
Thank you very much, Jorge, and it's a pleasure to be here. First of all, let me just say that Asia is normally this hotspot of anything that is crisis related. You know, we are the most disaster prone region in the world, the Asia Pacific region, and also in many of the pandemics that started before, for example, SARS, and H1N1 and others, it has really started from the region. So it's a region that's been exposed multiple times to many different threats. And fortunately, for at least for Malaysia, we have a very solid public health system that's been able to be quite resilient and has, you know, with the experience, been able to respond. But with this crisis, it has really exposed, you know, us on all fronts, the duration of the pandemic, the severity of the disease, the repeated cycles of, you know, movement restrictions have all badly impacted the social and economic activities in the country. And now, unfortunately, with the emergence of variants, you know, the region, Malaysia, Indonesia, Thailand, who seem to have had some decent control of the pandemic, is now facing surges in cases. Added to that, you know, we've not had the equity of vaccines that, you know, we would have wanted to have, and therefore we didn't manage to vaccinate people early enough, and therefore, you know, many of our people remain vulnerable to the disease. So we're definitely not out of the woods. But and when you look at a convention like this, you know, I'm fully supportive of it, because we can't go on, you know, pandemic after pandemic. And we know that this is a question of when and not if. We've been talking about it for years, and the next pandemic won't take too long to happen. I don't think it will be 100-year cycle like the Spanish flu and, you know, the pandemic that we are facing today. I think they will happen more frequently, in varying degrees of intensity and severity, but certainly we have unleashed upon ourselves, as a result of our damage to the environment, damage to the planet, you know, our unquenchable thirst for growth and development. So, but I want to bring the unique perspectives of the region. How will the region react to a pandemic treaty or pandemic convention? If I can speak for ASEAN, ASEAN is a region that often makes decisions by consensus. And it's part of the culture of the ASEAN region, at least, to be very non-confrontational. So as we move towards, you know, getting the pandemic to the political leadership in the region, we have to be very mindful of this. And therefore, one way is to maybe work on it from the technical aspect of the economic front and the social front and the health front, and building the case for the painful experience that we've all gone through now, that we don't want to go through again. The other challenge we have is China is a very influential power in this region, and it's also an important partner to many of the countries in the middle income and developing world. And this is a reality that we have to face. And unfortunately, the narrative that has come up with the pandemic has been very much geopoliticized. And I think this is very unfortunate. So we need to get, you know, countries like China on board to understand that, you know, this is for global good. So I think moving forward, one of the challenges we also have to realize is multilateralism writ large in the region is not as important, I think, as what I would call minilateralism, which means more on a regional focus, getting that, you know, get that buy-in and a consensus of, as a region before we move towards, you know, a larger multilateralism. So I think, you know, what we need to do is also get like-minded middle-income countries, the Chiles, Turkeys of the world, you know, that are similar to countries in this region, to actually then build that. I think there's opportunities with the what they call the G8 group, the developing country group that's established in Turkey. How do we get dialogue through that as well? So I think, you know, what I will say is that I think that, you know, we have to make health completely apolitical as a non-political issue. We have to consider regionalizing our approaches. We have to build a cadre of champions who will really try to bring in the technical sides, the economic sides of government to help us move this along. And I think it is possible, because if you look at ASEAN now, there has already been agreement to set up something called the ASEAN Center for Public Health in Emergencies and Emerging Diseases. Now, this is the first time as a region they've come together to do something like this. So it's that opportunity now to build on this, right? To say then, moving forward, we now need to have a policy framework, we need to have a legal framework, some kind of conventions that we need to then push forward, and working closely with other countries and WHO, of course. So, so I think I will pause there, and maybe we can take more questions later.
Well, thank you very much, Jamila. I think it was very clear about your points of view in terms of the Asian region, and we will have more questions about that later. And we are also receiving questions through the Q&A button there, so we will read them at the end. And if some others from the audience want to place questions, that's the button there, a Q&A button there, where you can post your questions, and we will try to address it at the end of the presentations. So finally, we will hear from Ms. Precious Matsoso. She's the Director General of the National Department of Health. She has more than 20 years work experience at executive management level. She has held leadership positions at national and international level for large international organizations in key strategic leadership positions, covering areas of public health policy and program development, ethics, and research. Precious has been also, until recently, member of the Independent Panel for Pandemic Preparedness and Response. And they identify unneeded topics that or actions that needed to address future pandemics. So we'll leave this space now to Precious, and hoping that she can also bring us some of the IPPPR recommendations during her talk. Precious, the floor is yours.
Thank you very much, Jorge. Good afternoon or good morning, depending on which part of the world you are. The world was not prepared, and these are the words of the independent panel, in which I was a member of, led by the former heads of states, the president of Liberia, and the Prime Minister of New Zealand. The key issues that came out of our report, firstly, is that there were weak links at every point of the preparedness and response chain. So in essence, there was a very slow alert system. This is despite the fact that we had the international health regulations. Countries played a wait and see kind of role where they just, did not respond timely. But I think what we picked up was that there was also the absence of political global leadership, and the depoliticization of this pandemic has become extremely important, because we saw politicization of the whole response at country level, but also extending to the level of WHO. Even coordination was poor, and science was being devalued. And we've seen how different leaders actually undermined science and took decisions that actually were not very helpful in responding to this pandemic. So we have to prepare better so that in future we're not in this position again. we have to prevent outbreaks from becoming catastrophic pandemics. And this we can do by having, of course, the immediate response is needed by moving vaccines, addressing these inequities that we've seen across the world. Those countries that have more supply of vaccines need to start moving them to those countries that do not have enough vaccines, so that we can make this world a much safer place and we can deal with this pandemic decisively. But we also have to start building capacity in low and middle income countries by facilitating voluntary licenses and technology transfers. Those were sort of the more immediate kind of recommendations. And WHO has to come up with a plan as to how we're going to end all of this. But I think the more relevant ones for the treaty or the convention are that on a long-term basis, we need to ensure that we have a mechanism by which the political leadership is sort of enhanced, but also ensured. So there's a recommendation that we need to have a Global Health Threat Council and a Pandemic Framework Convention. But because there's already provisions in the constitution of WHO, we're saying it's not something that can be delayed. Article 19 can actually ensure that this happens. So this meeting that is being planned for November should actually rely on that constitutional provision and ensure that we can come up with a convention. I don't think we need years and years of debate, discussions, negotiating paragraphs and so on, because we already have a vehicle that can be used. But there are a whole lot of other areas. We said, why do we need a convention? When we were discussing as a panel, firstly, there was recognition that there are gaps. The international health regulations by themselves were not adequate because countries did not respond. This is a legal instrument that has been negotiated over a number of years, and it has also taken a number of years for countries to implement. Even that implementation has been inadequate. So clearly we need something else to ensure that we can make this international health regulation instrument work. So the second was that the current legal framework needs to be strengthened, but we need to promote and endorse principles for effective pandemic preparedness and response. So those principles cannot just be in a guideline and so on, but we needed a much more normative way that enforce some obligations on countries so that they could implement this, but also clarify responsibilities between states and international organizations. So the convention would actually be complementary to the international health regulations and would ensure that a legally binding instrument could translate into much more proactive and rapid response, because we've seen the hesitancy of countries to respond. So this can help countries to work without hesitation, but it can also help us create a global alert and surveillance system whereby WHO can also do its work, and WHO can report, can inform, and can also inspect without fear, and can do that timelessly. WHO does not have to wait for a week or 2 weeks or a month before a country can say, yes, you can come in and inspect. This instrument should actually be enabling for WHO to do its work and to do its work timely and ensure that it has the support of heads of states in countries. But we need also some universal periodic peer review mechanism so that on an ongoing basis, we can assess and look at whether countries are doing what they're supposed to do. And there must be linkages within this whole international system down up to subnational level so that we can ensure that the reporting is not undermined in any way. But of course, there's been some financing problems. The preparedness has been grossly underfunded. And we're hoping that this time around, there must be investment in preparedness across the countries, within countries, but also in the regional structures. I think I will, pause there and so that we can allow for questions and discussion.
Well, thank you very much. Thank you very much, Precious. I think you set it up many of the topics right, and you also mentioned it, some of the challenges identified by the IPPPR, where you were part of it. And we receive a lot of questions now. I'm trying to balance them because some of them are addressing similar topics. And I do have another question to start with. And it's related, and probably Barbara or Precious or anyone else can address it. You know that the WHO was created after World War II. And now COVID-19, in terms of impact, not just in terms of deaths, but also in terms of economic impact, global economic impact, is kind of similar to a world war. So do you think WHO is enough, or there is something else that needs to be created? Or is it that WHO needs to be reformed to cope with the 21st century needs and also in face of future pandemics? Or do you think that's okay, that WHO can handle the way it is right now and in the future? Barbara or Precious, and I will come with some other questions for other panelists. Of course, the other panelists, if they want to address this one as well, I will ask you to be kind of short so we can have time for the other questions from the audience.
Shall I start?
Yes, Barbara.
Yeah, okay. First of all, WHO. I think we need to recognise that we really do need WHO, but we don't want to set up another standard-setting body, another norm-setting. That would just be a very serious waste of money. But what we do need is money to strengthen WHO. It just cannot do the work we're expecting on it, and the income is not assessed income. A lot of it's voluntary. You can't run a very serious organisation in these matters without actual guarantees of what monies you've got. The second thing is the question of WHO's authority, and whatever happens, it feels that we should strengthen WHO's authority as well. Now, how far can that go in delivering the sort of compliance that we want? And I think that's where the question comes. WHO is the standard setter, it's the technical support, it's the friend of the country, if you like. Now, can it be the same body that therefore also does the inspection and regarding compliance? And I think a lot of us think it needs something else. Exactly what? Is it an arm's length body to WHO where WHO says, we've been in, we've looked at this, we think that needs to be handed to you for a proper inspection and then compliance measures? Do you need that there, or do you need a completely separate body? There's a debate going on about that. The International Atomic Energy Authority is probably the one that's talked about the most as being a compliance body in another sector, really. But we do have to, I mean, you're right, Jorge, we really do need to think about how much can WHO do? Strengthen it, absolutely. We don't want to start from scratch, but do we need something additional, with that? But that's probably, I'll let Precious have a go. That's saying quite a lot already.
Well, thank you, Barbara. I think you've covered most of the issues. We also are of the view that we didn't need yet another structure. I mean, the whole international system has been created with lack of coordination, multiple structures emerging over a number of years, disease focused and so on. So what we propose is that firstly, yes, we need funding for preparedness, but also funding for WHO. So the proposal to have an international pandemic financing facility was made. And I think that proposal was to say we actually do not need another global fund. Instead, what we need is almost like a governance mechanism with oversight that is led by heads of states, because this pandemic was not just a health issue. It cuts across different sectors. And for that reason, we need heads of states to start taking leadership. And from that perspective, our proposal was to have the Global Health Threat Council that will be made up of civil society, heads of states, and different actors with an oversight role so that it can be supportive to the work of WHO. WHO must continue to do its normative work, and WHO must also not be everything to everybody and everything to every country. WHO must be focused, and this focus will actually help WHO do its work better.
No, thank you, Barbara and Precious. I also want to ask one question to Jamila. Because you mentioned it, Jamila, about the Asian countries, that they were kind of, because of a lot of other pandemics that started, not pandemics, but many other infectious diseases that became global public health emergencies of international concern, started there. So they have learned and they have kind of prepared. Probably that's the reason why they started coping with the pandemic better than the rest of the world. But it's also Asian countries very diverse politically. So how do you think agreeing on a convention will play? Because I mean, you mentioned it, that health shouldn't be politicized, but at the same time, a pandemic touches many other things, not just health. So do you think it's a challenge like Asian countries to agree, even with those political differences in many other aspects of the economy, trade, and many other things? That's for you, Jamila, and also to Ricardo. You mentioned transparency, Ricardo, as part of the requirements for a global public health convention. But you know, there are some countries that are quite challenging in terms of transparency, and I won't name them, but I could name them, but I won't this time. But there are some countries that are historically very difficult to address transparency in many topics, and in health is not an exception. How do you think that can be highlighted as a requirement for a new global public health convention in terms of transparency? And then I'll come back with some other questions. We have a lot of questions.
So I guess let me start. You know, let's not be naive. There's nothing that's apolitical, right? Whether it's a pandemic or a humanitarian issue or a development issue, inherently there's politics. But what I think we need to do, and I speak from the Asian perspective, and you're absolutely right, Asia is very diverse. And, you know, let me call a spade a spade. Let's look at ASEAN itself, the issues around Myanmar and democracy. You know, we're still tinkering around the edges. No one is able to really, you know, grasp the issue and deal with it, right? Because of this whole consensus issue and diplomacy and so forth. So I think this is the inherent problem in the region, in my region at least, that sometimes we're not able to take these things head on, this whole, consensus problem. This is why I said that we need to then go on a platform that hurts everyone equally, and that is economy. I think that will be the angle that you come in to address some of the more sticky issues like the pandemic. I mean, this is how, we can have that consensus that it has hurt us as nations in the region. And therefore, what do we now need to do to make sure that, that we don't have the same situation, we have this treaty that will be held accountable, and so on and so forth. So that's what I meant. But the other issue I want to raise is this, right? You can have a pandemic convention, but what is the enforcement and compliance going to be like? This is going to be the big elephant in the room, right? We have seen this. Let's talk about, the right to protect, for example, all the other instruments that we've had in the past. But where will the enforcement and the compliance be? And I think this is where I think I really like what Precious was saying, that do we need to have like another body to have some kind of oversight, because WHO will inherently be pulled into different directions and needs to do its job in terms of what its role is. The other thing I want to touch before I stop is I think we underestimate the power, the new power, I would call, right, of social media, young people, movements, and so forth. This pandemic has hurt young people. It's taken them away from school and colleges, and university, and it's taken their social life away, right? And it's created a lot of mental health issues, not just among young people, but I think they are very badly affected. So, and this is the group of people that we know will be able to rise and have their voice heard. So I think this is why I said about champions, right? And when you think about people like Greta Thunberg and the many Greta Thunbergs around the world, right? There's tons of them starting in Africa and Asia and everywhere. But the power of that social movement for change has led to, for example, Europe making a commitment to reduce the carbon footprint, by 2030 and so forth. So I think it's not impossible. So we've got to think a little bit more out of the box in trying to get some of these more sticky issues to move forward.
Ricardo?
And I'd like just to, a lot has been mentioned that in a way touches upon the compliance issue, which of course then leads to transparency or vice versa. To comply, we need to have access to data. We need to trust each other. That system of trust is very difficult to build in a global environment for multiple reasons that all of us are plainly aware of. That's why I believe that multilateral organizations need to use correct motivations for countries to want to come on board. And we know that financial incentives are the most relevant. And those that are seen to not comply with a global health convention, with a global health treaty, must not be able to have access to certain funding mechanisms that are critical in a global economy. What I'm saying is that, as you mentioned, George, we are facing a pandemic with, from an economic perspective, a warlike consequences, and future pandemics may have similar impact. So, not to be able to find this level of understanding that we all need to agree upon very strict rules, and those that do not play the right rules cannot be part of that global community, is something that I think that needs to be taken very seriously. There are different organizations that can play a role there, be it the World Trade Organization, the World Bank, the International Monetary Fund, among many others. And those that do not comply, the intelligence services of the other countries can come together to make sure that we have more updated information on this. The truth is, health and global health issues are also many times not, or in the past have not been on the agenda of many of the intelligence services, as they have been focusing on many other topics. Now, I believe more than ever, it's as important to understand the current standing, for example, of nuclear arms, as it is to understand the lack of preparedness and response, or lack of epidemiological data that is credible coming from certain countries or regions. And so I agree that there are some players out there that are not willing to come on board, but that's where the majority needs to come together and set the rules on behalf of humanity.
Thank you, Jamila and Ricardo. And I will try to summarize some of the questions. We have a lot, as I mentioned it. And I say that I won't mention countries, but one of the member of the audience is mentioning, so I need to mention because I'm respecting what the question is about. This is from Part Yoshi. He says, a country like China, who has not been honest and transparent about reporting the outbreak in the first place, even today is not allowing full-fledged investigation about the origin of the virus. Such a country has pretty huge economic presence and influence. And then he also mentioned the cases of how can you inspection like China, the US, or Russia. How can a WHO or a UN or this new body in case is created or has power enough to do something in those big and powerful countries in terms of inspectorate. Barbara, because you mentioned that, or anyone else who wants to address those kinds of challenges with concerning big, powerful, and influential countries like the ones mentioned by Georgia.
Well, I'll give it a go and other people can join in, because I think in the previous bit of conversation, we were saying, the compliance question is the absolutely central one that is so difficult to handle and what to do. So with the higher income countries, what do you do? Well, one of the mechanisms that's been suggested, and this isn't necessarily the right one, but it's a sort of set of ideas, is that the IMF in Article 4 has the ability to look at the financial stability of countries. Now, if you wound into that, the stability that comes from having proper preparedness and action around a pandemic, and you may be threatened, or not threatened, you may be downgraded a bit because you don't do the right things, then that starts being something of a disincentive to at least the wealthier countries as well as the poorer ones. As I've said, in the opening, the lower and some middle income countries you can do because they need an awful lot of resources to get going, and that itself helps with compliance. But we do need to think for these other countries. The only second point I'd make is, to get this going, I don't think we need everybody in it all from the start. And it's very interesting with a lot of treaties, actually, that you get going with a good, strong body, yes, at the beginning of that. And then other countries begin to see the point of why that is working and actually come and join in on those. And we've seen that actually, particularly with the US, where there are issues about signing treaties. But nevertheless, the US has responded by actually complying to those things, even though they're not actually they haven't ratified the treaty. So there are ways to do that. And I think that was even true, we keep using the example of the Ottawa and the landmines, that was all done by a small group of countries. And because it was so sensible, gradually more and more countries have joined in. So ideally, you'd go much further on this from the start. We need many more countries in because of the nature of this pandemic. But we shouldn't be put off that there are going to be some outliers at the start, and we need to actually find ways as we get in there that it makes sense to them to be part of this as well. But that's my view, and I'd be interested in the other panel members too.
Yep, I will also include this other question because it was the first question, because it's linked to that one, because Veronique Taker is asking, what kind of incentives might we use for high-income countries or wealthy countries like Europe, USA, Australia, to ensure they are compliant in a treaty or a convention? So I think they are linked, because we're talking about some countries that not necessarily work well in terms of minor incentives or some financial incentives. That's probably not the best way to incentivize them, but some other mechanisms like the ones you just mentioned, Barbara. Someone else who wants to address this combination of two questions? I think Precious was trying to.
No, I was just going to say, yes, I wanted to add to what Barbara was saying, to say that, we're debating and discussing the principle of a coalition of the willing and the able, as to, in this day and age, that would be a good idea, but you also don't want to leave others behind. And you also don't want to exclude those that are likely to be the problem. So maybe as a start, it would be good to have the coalition of the willing, but then, incrementally ensure that you can bring as many countries on board and building those incentives, but also include the disincentives, because it's both a carrot and, a approach and a stick approach. Thank you.
Yeah, we have another question from Lorena Lizarde. And she's saying it's a global digital health future, something that will help get medical information and data faster, resulting in faster diagnosis and recommendations for treatment. I think the response is yes, but should be part also of the Global Public Health Convention, digitalization of the health information to get like faster information? Do you see that as part of the Global Public Health Convention? Barbara or anyone else?
Well, I think others may. There are others who are more medical than me actually on the panel here. They may know better, but clearly, already the digital is making a huge difference in all the trials that are going on about treatments and so on, as well as the things like the variants and all those sorts of things. So yes, this has got to be, it has got to be enormously helpful, and it's one of the things that in fact maybe a one sort of positive outcome from COVID-19, that those systems are being built up, because we do need, like everything else in this, it's because it's a global thing, we need global data as well to see what's happening throughout. So it's very important. Whether it should be in the treaty or not, I don't know. It feels like this is more of the science base, where actually there is a very strong push already from people, the medics and the scientists. They really want this, they know how useful it is, so they probably need resources behind them, and that's important. But it's not so much like the actual drugs and vaccines, where there is such global unfairness that you need some other mechanism, really.
There is an anomaly.
If I might add to that.
Yes,
I fully agree with what Barbara was saying, and we see the role that technology and digital will have to play. I mean, one of the reasons we are so far behind in different parts of the world is precisely how genomic sequencing is so difficult in certain contexts, which means we are constantly many steps behind the virus in terms of its evolutionary process, and how that then has impact on the way we need to respond. But there are other angles in terms of research and development. I think the world has taken important steps when we look at vaccine development, for example. We still haven't seen a treatment that is sufficiently efficacious for the treatment of COVID-19. So there is room for improvement even on that side. But I would even go further to say there are areas in which we need to evolve in terms of digital, in terms of technology, that we are still very far behind, still dealing with these kind of pandemics as if we were in the 20th or even 19th century. When it comes, for example, to logistics, to distribution, we still need to evolve. We've seen some pilots on using drones, for example, of getting access to certain difficult parts of the world, but there's a long way to go there. On the other hand, in terms of manufacturing, production, so we are able to develop an amazing vaccine, but then we take forever, pandemic timeline, to get them developed and processed and manufactured and on the ground in a timely manner. And as we know, as the longer we take to vaccinate, the easier it is for variants to come about. So there is room, I believe, in terms of research and development and using, and particularly digital technology, to make sure that the different parts of the value chain of response to pandemics, that we are capable of doing better. And of course, from the preventive side, in terms of epidemiological and syndromic surveillance, being able to do that more with greater impact, and to be able to prevent future phenomena much earlier than in the past.
Thank you, Ricardo. There is a comment, anonymous comment, and says that at the Global Public Health Convention, it seems that there is no item that deals explicitly with promoting human behaviors, and it provides an example. Like in the US, even with highly successful biomedical tools, suboptimal preventive behaviors still make risks substantial. So is that something that needs to be included as well, the promotion of human behaviors? Or is something that just be left to countries to deal with the behavior of each one of their own citizens? Anyone?
And I'm ready to start and let some others join in. I think there are so many complex issues in this. First of all, one of the big problems is, of course, that all sorts of different countries and people within countries have spent their time saying completely different things, either in different countries or in one country at different times. And if you start doing that, then you completely muddle up your people. And then the more you do that, the more they will do whatever they think is right for them. Or, you sort of ignore things because they think they just don't matter. So I'm sure that actually having more coherence in what is being said across the world has got to be a good thing. I mean, the other part of that, which I think is somewhere else in another question, is actually the people who are putting out wrong information. And clearly that's another part that has to be corrected, where we need, all the IT area to be looked at much more carefully. But I think the other thing I'd say is, we are learning more and more about what makes people do things and therefore how we can encourage them in the right way. For instance, I know in some of the behavioural work that if you would say to people that everybody else is doing this, then they are more likely, the person who isn't doing it, they are more likely to do it than if you tell them, a lot of people are not doing it and you really ought to be doing it. That it's part about being a part of a community, about being part of a crowd and so on. And if you think you're being left out, very good evidence now that that's the way to help push you along. So I think some of the behavioural studies that are happening are also in their own right very, very important. But I do think that if you have government leaders who are disagreeing amongst themselves, disagreeing with scientists, changing their minds and not using the science, as Ricardo has said, you cannot expect good behaviour from the public. It's just, they just don't trust. Back to Ricardo's points about trusting.
Yeah, in terms of trusting, Barbara, or anyone else from the panel, there is another question that asks about the role of social media and misinformation. It is something that needs to be considered under a Global Public Health Convention because it looks like during this pandemic, misinformation, social media are playing a big role in terms of not just of human behaviors, but also political behavior as well. So what can be done to mitigate this kind of influence that sometimes turns to be a negative influence, irrespective of what is the scientific recommendation?
Can I try to answer that? Yes. I think that this is a real issue and something that has emerged really prominently with this pandemic. But I don't think that you can have a global convention on social media misinformation because different countries will have different rules and how they deal with social media and information. I mean, this is my personal opinion. But I think where WHO plays a very important role, and I think it has done it quite well, is that it has really stepped up its game in communications. I think we see this quite, I'm really admiring the media team at WHO coming up with science, coming up with evidence, the five-minute clips, really having share verified, for example, partnering with Reuters and really, getting people to be aware that there is misinformation. But this is the challenge we're going to face from now onwards. The minute you have a cell phone in your hand, information spreads at the speed of a send button, right? But as a global convention, I would think that the main issue we're dealing with is really about the accountability of countries to to inform, to protect the IHR, all the things that Barbara mentioned earlier on. And I would think that at a national level and at, I think, personal and community level, we all need to tackle these issues around misinformation and use the international bodies and trusted sources for information.
Yeah, thank you, Jamila. There's another question here. What international bodies need to be involved in developing a treaty or a convention? I think the WHO and the UN have been mentioned, but are there other international bodies that need to be involved in this kind of treaty? And I will add also, do you think this treaty or convention needs to be under the scope or under the umbrella of WHO, or it needs to be above? So I leave it to any of you who would like to address this question.
I don't mind stepping in because I think there's a lot of politics in this discussion. So the obvious answer would be WHO should be doing the job. They have the emergency response team within their organization. And I think, as has been mentioned before, underfunding for their global task is obvious. I mean, the WHO has for their global mission a budget that is exactly the same as 20% of the National Health Service of Portugal. So it's obvious that they cannot respond with the current resources to the needs that we have globally, especially with everything we're discussing right here. I personally, we've been talking a lot about World War II and how WHO came out of World War II. Another organization that came out of World War II was NATO. And I've mentioned this before in other webinars we've been together. And the way that different countries in the North Atlantic came together to understanding that it has such a bad impact on our economics that if we go back into war, that peace and prosperity are much better for the well-being of the people and for the growth of our economies. And so NATO was created under the premise that if we work together to deal with cross-border threats from a military perspective, from a defense perspective, and coordinating our actions, being able to go and do our war games, our simulations, making sure that we are better prepared in the future, then that we could be better protected. And the truth is, it's been successful from a military perspective in general. Looking now at global health and looking at the global scale, and following this pandemic, I believe that we need to understand, and WHO needs to step forward to say if they are capable of leading the way of doing something similar when it comes to global health, of creating that multilateral platform that has not only the diplomatic political side, but also that operational side that is critical and that is capable to give the proper guidelines to the political side to do what is needed, along with the needed resources, of course. The thing is, WHO, one of the problems it faces today, and I think we all acknowledge, is it does not take one single step except if member states approve. And we know that in the time of pandemic, getting more than 100 countries to agree on anything is virtually impossible in the timely manner we need it. So I would say that at the end of the day, I just want this to get done from a political perspective. And if WHO wants to do it, then member states need to agree that pandemics have to have exceptional rules. We cannot deal with pandemics the same way we deal with mental health or the same way we deal with cardiovascular disease or whatnot. We need capability to respond in a timely manner, which means that the technical side moves much quicker than the political. And they need to have that flexibility of mobilizing action towards impact. If that is not possible in that context, then we may need to consider something else. But creating something new will take time, and time is of essence because we see that people are already starting to lose interest in COVID if we do not push for change now. So it's an important issue to get the job done as quickly as possible. And I think that that is only possible if a group of important and influencing countries, due to their financial capability, be it the G7, the G20, or a union like the European Union, are capable of taking the lead, because we know, sadly, that in this unequal world, those that have less financial impact and influence, their voices, that many times they're the ones suffering the most, are the ones that have less capability to push things forward. And there is a moral obligation from the richer countries of the world to take lead and make things happen.
Yeah, well, thank you, Ricardo. There was a question for Jamila, but I think she already answered it, because they are saying that health cannot be made apolitical. So, well, Jamila already mentioned it, that what are the challenges to make it apolitical, because everything will be turning into political issues. Another question is, does the global health has mental health as a second wave? Or I assume that as another pandemic as a result of the current pandemic. Will that be also included, or are we talking mainly about infectious diseases that can be transformed into transmittable pandemics, or mental health can be considered as well? That's the more specific question. Anyone?
Well, we recognized during the work of the panel that mental health, I mean, every society has been traumatically, affected by this pandemic. And I would start actually with the health workers. I'm actually surprised that they're still standing, they're still providing services across various waves, and they've experienced trauma from the point of view of losing their colleagues, point of view of dealing with multiple deaths of patients that they had to look after. Then we also have a trauma for those who lost their loved ones during this pandemic, but we also have trauma of those who lost jobs and their livelihoods. So mental health is probably going to be one of the biggest issue that probably needs attention now, meaning we need to start preparing for responding to this explosion of all these mental health disasters that are going to confront us down the line. So I fully agree.
Yeah, there is another question here, and I will just put it into context. And it's about vaccines. So the question is, if we already had like the new Global Public Health Convention or a new treaty on global public health agreed by all countries and everything starts working well, will this prevent like another crisis on accessing to vaccines, for example? If another pandemic comes or something like that happens, how that can be challenged or included to prevent this crisis of accessing vaccines of countries that need it the most, or especially developing countries that have been having quite challenges in order to access vaccines now. And there's another issue of some countries that are producing vaccines and hoarding the vaccines for themselves initially. So can that be prevented under the new Global Public Health Convention or treaty?
Well, in the first place, we had suggested in our report that the initiative by WHO with different partners to establish Act A was a good one, and COVAX. However, it has its limitations and it needs to be transformed. If we are to prevent these inequities that we've experienced, we'll have to reform, in fact, transform, not reform, transform Act A and COVAX. We also have to recognize that, tech transfer needs to be made a reality so that countries with an opportunity and capability to produce must be able to produce vaccines. We cannot have vaccines produced by a few countries and we still cannot supply the whole world when these are needed most. This pandemic knows no borders. And if we fail to vaccinate some parts of the world, those who have vaccinated are not out of the woods yet. So it means we're just postponing the development of variants that will spread quicker. And it means it will just be a vicious cycle. So we need to be far more practical and responsive. The first thing is to transform Act A and COVAX so that it's more inclusive and it's not limited in approach, and it can address all these global issues and start dealing with vaccines, diagnostics, and therapeutics as global public goods. Thank you.
Thank you, Precious.
Can I add to that just a bit? I mean, this is less the panel that, we talk about the health convention, because I agree with Precious, there must be things in protocols in this convention, but we haven't worked on them very strongly. But going back to my own history with Oxfam and the whole TRIPS agreement that we argued for so strongly with actually Treatment Action Campaign in South Africa and so on, way back in 2001, 2002, we do have a TRIPS waiver. And the fact that countries are actually stopping others at producing, of course, there's a tech transfer part. I mean, I agree again with Precious, this is more complicated than drugs, clearly. There are cell cultures that have to move and all sorts of things. But nevertheless, assuming that you can do tech transfer, then it has to be possible for the TRIPS waiver to be used to say, we have rights to produce this in our country. At the moment, countries are not doing this with vaccines because they're being threatened in various trade ways. Now, that is absolutely outrageous in the circumstances that we're in. And that's the sort of thing that probably does need to go in some sort of, in the protocol that would be on the global public goods, really. But that's a rather passionate personal approach to this, having fought for the TRIPS waiver very hard.
Yeah, thank you, Barbara. We are running out of time, but I will ask one of the questions here, and probably Meredith, who's helping us backstage, can take care of the unanswered questions because there are many still here pending for answers. So I want to read one of them. Last week, the G20 high-level financing panel recommended creating a global health threats board with finance and health represented to oversee financing, while also supporting the need for a UN-endorsed Global Health Threats Council and WHO. Do you agree that with this global pandemic, with a new global pandemic prevention architecture that includes, in this case, a finance ministers or the finance sector that needs to be there as at the top level or one of the top levels? What do you think about this possibility under a new architecture?
Well, maybe I have to respond because we recommended this. The first response is that firstly we need this council that will be at a head of states level, of course with the involvement of civil society and other partners. But we also recognize that the G20 finance ministers meet regularly. They can immediately, with the what I said about coalition of the willing, they can immediately meet and make funding available so that preparedness can be funded. Preparedness has been grossly underfunded. In fact, we're where we are precisely because of that. So they need to start with making sure that there's adequate funding for preparedness. And if they've come up with this proposal of a board, I think it must be welcome because we can start doing the work now to prevent the next pandemic from happening. But it doesn't, of course, exclude others. Others can join, but those that have the means can start immediately. I think this is what we're recommending.
Well, thank you very much, Precious. We still have a lot of questions here, so I think we might be able to respond to some of them via email or text messages. And we only have 5 minutes left, and just want to first thank all the panelists for these your presentations and the thinking and trying responding and also trying to respond some of the challenging questions. I know that we cannot have the exact answer to every single one of them because there's a lot of discussion going on, and even with these proposals, there are a lot of others that need to be involved in order to address some of these issues, including the challenges posted here by many of the audience members that are keep posting questions here. I know that, and we know that this needs to be taken seriously, and that needs to not to be ignored. And well, last year we thought what we were about the ending of the pandemic, and still not happening. And probably with the new variants, the current pandemic will take longer than expected. But I think these discussions are helping to, in order to disseminate the need of a global public health convention for this new 21st century, and also the work of the panel that Barbara is leading, and all of you as members and interested people in discussing these challenging issues can try to include into other bodies, not just the traditional ones, but of course, not ignoring the traditional ones that probably some of them, they will need to be reformed or profoundly reformed in order to address what we are seeing now. Now I'm gonna ask Sandro if he has some last comments on the issues, or even if Sandro wants to comment on the discussions or try to answer some of the unanswered questions here. Sandro, I will leave it to you.
Thank you, Jorge. Thank you, Dr. Saavedra. The COVID pandemic, it's a global tragedy, and nothing redeems a global tragedy. But if we did not emerge from a global tragedy by learning and by using the moment to learn and do better, then we compound the tragedy, as far as I'm concerned. And one of the moments, one of the most interesting things about this moment is that we are beginning to tackle questions like what this global convention discussion has been tackling, which is to say, what have we learned so that we can do ever better? So I really have deep gratitude for all of you for the work that you have been doing, Dr. Saavedra, Dame Stocking, Dr. Mahmoud, Matsoso, and Dr. Batista Leite, for the work that you've been doing on advancing these ideas. And there were some terrific questions from the audience, and really we had this amazingly global audience of hundreds of people at this in this, with questions keep coming. And I think it's because the ideas that you're proposing create more questions, which is exactly what good ideas should be doing. And I think there were some disagreements and some agreements, and that's how it should be, because I think that's how we as a world, with a plurality of perspectives, move forward to finding a better place and a better way for us to operate. So really, thank you. Thank you for the work you've been doing. And I want to also thank the audience. I want to thank the audience for engaging with these questions. The audience is not only engaging with these questions here, but I know that the members of the audience are engaging with these questions in their own context. And I think this is how we as a world take what has been this tragic moment and learn from it to create a better world for the next generation. So I want to say thank you to everybody who has been doing that. I want to thank the University of Miami, Dr. Saavedra, also Dr. Shapaznik, who I know has been very much involved in shaping this right from the beginning. And thank you to all of you for everything you are doing to improve the public's health. Everybody, have a good evening.